Very good morning, everyone. Welcome to this morning's HEE South East Aspiring Nursing Associate webinar. My name is Kat.Tolfree. I'm the Programme Lead for Nursing in the South East, and it's my pleasure to welcome you today. HEE, as an organisation, we work as a part of the NHS supporting the future workforce, educating, training and planning the future workforce. And Nursing Associates is a part of our future workforce of the NHS. So we're really glad to have you here today with an interest in becoming a nursing associate. You can see that the Southwest covers a little, quite a big patch really. So we're working all the way from Buckinghamshire over to Kent and Medway, and we know that all of our participants today are from a wide range of places across that whole region. The photo on the left is my nursing associates that I met a good few years ago now. This was the cohort that I supported in practice, my very first trainees. So I've got a personal investment in having seen these professionals grow from being care support workers into now registered nursing associates into their second year of practice. So I hope that you get inspired through today's webinar and that becomes your journey as well. So today we are recording this event for colleagues that aren't able to join us live. We have received many questions through from when you've registered, so thanks very much for doing that. And we're going to try really hard to get your questions answered throughout all the presentations today. But if you've got any other questions, just use the question and answer box that's on your on the top tab of MS Teams Live, and we'll be able to see all of your questions that come in. You won't see them yourselves, but just recognise that we are going to receive them, and we'll try and answer them in the question and answer session towards the end. And if we don't have time to answer them, we'll make sure that we get question and answers out to you as a document after the event. We will share the recording with all of you, and for those of you that aren't watching this live and you're watching on catch up, hopefully that's really helpful, and we will share all of the slides as well, so no need to worry about that. We can't actually see or hear any of you, so at the moment it's quite strange. I'm just talking to myself here on the laptop, but hopefully you can see and hear us. And we'd really like you to join in the conversation on Twitter if you're using Twitter this morning, using hashtag NursingAssociate.SE and tagging our HEE Southeast account that you can see on the screen there. So today's session is hopefully going to be really helpful for all of you that are interested in becoming a nursing associate. We're going to explain what the nursing associate role is and a little bit about the history of it, because it is a really new role to the NHS family. We're going to then move on to speaking to a colleague from one of our universities about the programme of study for becoming a nursing associate. Then a little bit more around the career opportunities that it can bring as being a nursing associate. We've had lots of questions around that. Onto our question and answer session, and then just wrapping things up for you nicely towards the end. So lots to cover in the 2 hours. So first of all, I'd really like to introduce you to James McLean. James is our Health Education England Deputy Chief Nurse and is our Senior Responsible Officer for this work as well. So he's going to just introduce a little bit more about the role to you. James.
Thank you very much. Kat, thank you for the introduction. Hi everybody, it's great to be here, and I thank the team for inviting me to come to talk to you a little bit around the history of what a nursing associate is and how it came to be. It is a really new family role in the nursing family, and our registrants are now in their second, our first qualified are in their second year of practice, as Kat said, and are making huge differences to the quality of patient care. So Lord Willis of Knaresborough was asked to look at nursing and a fair few other bits and pieces around health and social care in the Shape of Caring report, and that followed some quite grisly health and safety issues that were noted across health and social care, and we recognised from that there was a skills gap between those people that wanted careers in the health service at a healthcare support worker level, and in between that and a Band 5 registered nurse, and that's across all 4 domains of nursing, so mental health, learning disability, adult and children's, and from that there was a working party set up to look at what we could do to support that gap in that skills and competencies space, and also provide people an opportunity to get into a career pathway that they may not not have had in previous iterations of nursing. And as nursing has gone through from being a vocational training and almost apprenticeship training course through to degree level training, various iterations of program have missed our bands 1 to 4 in their development spaces. So Shape of Caring was a really welcome report, and the TNA was born out of that report. So we've got a training program that is looking at people in that holistic space, so we can cover the whole of the nursing family. So you will get experience working with adults, working with children, working with mental health and learning disability services. So you can provide a comprehensive care package to our patients. The education and theory is there to support enhancing your practice, and we're taking this through to a level 5 foundation degree space. So you are getting access to that higher education and learning in a university environment, but also being able to consolidate your skills on a daily basis in clinical practice through your substantive contract in a training nursing associate apprenticeship post. We want to provide you with the skills and competencies that will directly support the registrant nursing staff, whether that be in a ward environment, whether that be in a unit environment, or whether it be in community or primary care services. The benefit of nursing associates is that you can actually work across the whole gambit of health and social care. And offer us a really great adjunct to nursing in the space of making us all care for our patients using the best evidence and the best to gain the best outcomes. So it's a standalone regulated role through the Nursing Midwifery Council, and that is there really to provide public assurance and make sure that we are maintaining the standards that we would expect of anybody that is delivering health and health care to very vulnerable patients in the main, and also to be able to offer you assurance that actually your training meets a certain standard. And the NMC, so the Nursing Midwifery Council, are our regulator, and they set what is the standard. And if you go onto their website, it gives you the comparisons between that and the nursing family. I've already mentioned it, it's an earn and learn program, very much in the apprenticeship space, but it also widens that participation and widens access for groups of people that are not necessarily in that space to go to a university to study at a high level straight away, and or they want to have a look at a second career opportunity. So looking at COVID-19, whilst absolutely has been a massive issue for the UK and the globe, we are now seeing that people are looking towards healthcare as a second career and trying it out from other aspects of our employed worlds. And because most people have got responsibilities in that state, to drop that all and go straight into a full-time degree program to become a registered nurse is quite difficult because the finances that are involved with it. So this absolutely opens that world up. It gives us a great opportunity to access all of health and social care, and whilst you are in our training program and accessing things like adult, children, mental health and learning disability, these may open up your eyes into different worlds that we've not seen or you've not considered previously, and offer us a much more flexible workforce moving forward. The research that we are conducting at the moment with our sponsors in the DHSC, so the Department of Health and Social Care, is all focusing on how are we going to maintain this role as in a critical mass. We've got about 4,500 registered nursing associates on the NMC register at the moment, and we're wanting to increase that exponentially. So we have targets of around 5,500 a year to meet, but we will get to a space where actually we need to get far more into the system to keep up with demand, because everywhere that's seen and has a training nursing associate and a registered nursing associate want more, because the flexibility that they offer, the the depth of knowledge and understanding that they can add into the ward environment or the care environment is absolutely fantastic, and it's something that we're wanting to do. As I say, it's a standalone career, so you can get into that registrant space, but you can also then, if you really fancy it, and this is something that you are enjoying and are motivated to do, is then access the registered nursing associate to registered nurse degree top up, and that's a 2-year program to get you into a registrant space. So and then again you can specialize in multitudes of care environments. So it is a really flexible role. We understand that people would like, in the first research bits that we did, 60% wanted to move on into the registered nurse space, but absolutely we're seeing those people consolidate their learning from nurse associate in the first instance and then progress on to the top-up degrees. So an element of consolidation is really important in this space. So it is a really positive programme. It's working its way across the whole of England, and we've now also got our international colleagues working out how they can start to emulate some of the programme quality that we've got in the nursing associate world. And that's me. Thank you. Anything that you'd like to add, Kat?
Thanks very much, James. I hope that was a really helpful, summary of all of the work of nursing associates to date. Really interesting to hear that we've got 4,500 qualified nursing associates on the NMC register. The workforce is really growing.
It is, and we should have around 6,500 by the end of the year. So the numbers are ramping up. Yes, we had a little bit of a blip through COVID with some delays, but we're now catching those people up.
Fantastic. And yeah, it's really exciting to hear that, we're just looking to really grow this workforce. Like you've said, I think that the impact to our patients and the care environment, it's just fantastic that we can offer this as a flexible route for people. So yeah, thank you very much for your time this morning and joining us.
Speak later.
Thanks.
Bye.
So I'm just going to introduce this next video now, and this next video was created by the Nursing and Midwifery Council, which James referred to, and that's our regulator as nurses, midwives and nursing associates. And the video just comes from a nursing associate's perspective and also an employer's perspective about what a nursing associate is.
One of my friends had cervical cancer, and every time I went to visit her at the hospital, I could see the way the nurses used to put so much effort to look after her and give her so much love. And I thought to myself, this is something I would love to do.
I couldn't afford not to be working, and so this was a great opportunity that I could still further my career, follow my dreams, and still work, and it's sort of 2 in 1 at the same time.
The nursing associate bridges the gap between a healthcare assistant and a registered nurse.
The nurse associate role, I think, fits neatly in between, and it allows the nurses to do more complex care.
They are the next level down to a qualified nurse, but their skills are vast and will be greatly utilised.
I've had some really positive feedback from registered nurses who have recognised that the trainee nursing associates coming to them have brought skills with them that have actually helped the registered nurses in their roles.
For me, the nursing associate encompasses everything really. It's that holistic approach to patient care. It's not just specialising in mental health, physical health or learning disabilities. You can support anyone with any need in any environment.
The beliefs and ethics of this, we're making the patient the focus. It is all patient-centred care, and this is what we need.
You need to be there for them 100%. So I think the connection between the patient and the member of staff is vital for the recovery of a patient.
The registered nurse can delegate confidently, knowing that the person they're delegating to is fully accountable for their own practice.
Being a regulated professional is very exciting because it's giving me that empowerment that I'm able to do things and knowing that it's going to have an impact on the patients.
Being regulated is going to be a safety net for all of us. We're going to be supported, and then the patient at the end of the day will receive the same quality of care that they need.
For me, the journey from the nurse associate role has been exciting. It's been a completely unique set of experiences where I've just been able to grasp so much, and it's just been, yeah, word I was going to use to describe it, and one would be exciting.
It's built my confidence immensely, and that is what I'm really proud of.
Thanks, Devon. I think that video was really great, just hearing from nursing associates themselves. We're going to hear from our colleagues at BNU, Bucks University now. Okay, great. So I'm really pleased to introduce to you Professor Karen Backwell-Nutt. Karen is the Director for the Institute of Health and Social Care at Bucks University, and it's our privilege to have her join us today for this webinar. Karen, over to you.
Thank you very much, and I appreciate the time that you've given me here. So I've been asked to talk a little bit about the nursing associate and what it is and how you may be able to get on this course. So I think one thing to realise is that this role has been developed in response to the workforce needs of the NHS. And it's been progressing since actually around 2017, 2018. And we've got lots of nursing associates now, they're in their thousands across the nation. And it has become a registered role. So the Nursing and Midwifery Council have nursing associates on their register, the same as they would have for registered nurses. But the scope is somewhat different to a registered nurse. So this role is a generic role. So what I'm meaning by that, you could be looking after somebody that is elderly or a child that is really quite young. So the nursing associate role is very much to support that registered workforce. And what you'll also find is certain areas will have a number of nursing associates specialising as well. But for the training purposes, I think it's best to consider this as a generic nursing role as opposed to specialising in any of the fields. In order to get this, it is a 2-year foundation degree. I think if you look across at any universities, you'll find that it's that format. Now, you can get on the programme in 2 different ways. You can get on as a normal student that would apply to a university, and that's through the UCAS route. And that would mean that you would need to fund the programme yourself. So you would be looking at paying the fees, and you could do that on a personal loan level, or you could actually do this and have the student loan company that's a national, and you take out a student loan and repay that. Or you could come through the route as an apprentice. So in other words, you could be employed. I mean, we work with a number of employers, and in this area we work with Oxford Healthcare and Buckinghamshire Healthcare Trust. So you could be employed and then come onto the programme as an apprentice. Now, what that means is the employer pays the fees for the course, so they pay the university for you to be on the programme. So you're not taking out a loan in that way. And I guess the best thing to sort of talk about the nursing associate is actually a gateway to career opportunities. So, you know, I think any nursing post in the NHS can lead you to a direction that you hadn't even thought of. You know, you could specialise. So it's certainly a gateway, and a lot of people stay in the nursing associate role. Other people actually then progress on to become a registered nurse, whether that's in adult, mental health, learning disability, or children's nursing. So again, it's the beginning of a career opportunity, really, and the careers in nursing are endless, as you hopefully would have realised. So a little bit about the course itself. This is a course that's divided up into theory or academic study. Now, don't worry too much about that. And it's also divided up into a practical component. In other words, out in the workplace, in the placements. So a little bit more about the theoretical component. It is classroom based, but we also now do a lot of online teaching as well. And we also do what we call simulation. So we simulate what a practice environment would be like. So we know that as nurses start on their career and their learning, that they come a little bit frightened around how they would care somebody, how they would care for a real patient. And the picture you see below is not a real patient, it's actually a mannequin. So it's a life cast mannequin. I call her Frida. So, you know, you can practice and feel safe in an environment that you're not actually with real patients as such. So that would be as part of the university. The key things you'd be looking or being taught is the professional skills of what we expect from a nursing associate and the nursing profession, but also those academic skills. So some of you may not have studied for many years and may be worried about thinking of writing your first essay. So we actually teach you those sort of skills. Anatomy and physiology underpins a lot of the care that we give. We'd be looking at community and public health, and also evidence-based practice and research. Now, some of those terms may not be familiar to you, and that's fine, because you will learn those as you go through the 2 years. And I think the biggest part as well to consider is what it means to be in practice. So with the practical component, you are in placements. So those placements could be in acute hospital setting, they could be out in the community. And because this is a generic role and possibly could lead on to you doing your registered nurse, we work with our placement partners to ensure that you get experience with paediatrics, in other words, children, adult, learning disabilities and mental health. So it gives you an absolute grounding of what you need to do to gain the nursing associate competencies, but also if you wanted to go on to possibly do field specific work and registered workforce. So I'll pause there at the moment in case there's a question that might come up.
So we've had a question that's come through, Karen, I think that's based around placements and practice. And somebody's asked, they've read about protected learning time. What does that mean?
Okay, so with the Nursing Midwifery Council are the sort of governors and the gateway to this profession, and they lay down certain requirements that any education provider has to give. So they have laid down the fact that we need to make sure that learners have protected learning time. And what this means is that they have time to do their academic study, but also time to be out in practice and actually learning. So the aim of protected learning time is the ability to be able to develop new skills, knowledge and understanding. Now this is particularly important if you do the apprenticeship route, because we need to work with your employer to ensure that when you're not in classroom or not on an alternative placement, that when you're in your work area, you do get the opportunity to shadow perhaps the multidisciplinary team, that you go on ward rounds, that you can attend case conferences about your patients. In other words, we need to protect time that's outside of your regular work duties to give you the opportunity to learn. Does that answer the question, do you think, Kat?
Yeah, I think so. I think that really helps kind of, so for the people that are attending, they understand that it's just going to help their learning journey throughout the programme.
Absolutely, and as I say, if you're an apprentice, different employers will have a slightly different model of what they offer, but we work really closely with them to make sure that that protected learning time is given. And for students that are on the direct UCAS route, the protected learning time for academia, in other words, that theory part, is in classrooms and study, and then the placements themselves become that practice protected learning time as well. What I'm going to do now is talk a little bit about actually how to get on the course. Now, we as a university have our own set criteria, and each university does that under the guidance of what the programme needs to be a foundation degree. So what you'd need to do, whether you were looking at us at Buckinghamshire New University or any other university in your region, is to look at the website to see what the entry criteria are. Now, typically, certainly for direct applicants, you'll hear talk of a tariff, a UCAS tariff, and that could be anywhere between points of 32 and 56. Now, you don't need to worry too much about working out your UCAS tariff for direct entry, because the university admissions team will support you and help you on that. But typically, we'd be looking for some GCSEs around grade 4 or C or above, and certainly something that's equivalent to maths and English at functional skills level 2 as an academic background. So again, what we want to try and make sure is that we get the right people onto the course. So as well as it being your academic background, and it's about you demonstrating that potential to study at level 5. So when you start the foundation degree, year 1 is level 4 and year 2 is level 5. So any of you that have been at further education colleges or indeed done any formal development in your trust areas, you probably would have been studying at level 3. So you can see it's a graduated step up that academic level. So we want to make sure that we've looked at your entry requirements and that we think you've got the potential. And certainly functional skills at level 2 or the equivalent stands you in good stead for what you need to do on the course. And again, if you're coming through the apprenticeship route, your employer will do a pre-internal screening. And again, we work with them really closely to what would be acceptable for an academic background. But if you're unsure, ask the question, really. We do value-based selection. In other words, we're not looking just for your academic abilities or potential, but we're looking to make sure you've got the right values to become a carer. So again, many of you may have done care experience and thinking, well, of course I have, I do the job already, but we need to make sure you're ready for that next step. So again, we do value-based selection where we sort of tease out if there's any areas that we have any concern about. And again, we do joint activity with our practice partners, in other words, the trusts and the NHS and private providers, but also we have service users on our selection panels. So again, they're the people that receive the care at the end of the day. And from an experience background, with regards to background, if you can demonstrate those attributes and skills, that care, that compassion, the ability to communicate, the ability to work with teams, that's what we're looking for as an experience. And again, apprentices, if you're coming through the apprenticeship route, you'd have to be employed by a healthcare provider. You can't just apply to become an apprentice straight to the university. Does that make sense there, Kat? Have we got any questions on this, do you think?
I think there's a couple of questions here, Karen. So selection, does selection mean interview or does it mean my application form?
It means both, actually. So in order to actually meet the criteria, then you invite you to an interview. So that would be the application form itself. And I'll talk about that in a moment, how some top tips on that. So the selection is, you know, making sure we get the people that can meet this level of study and can succeed, because we certainly don't want people to fail, no more than the employers or any of yourselves or family would do. But also the interview piece itself, because we want to know who you are as a person. And again, the interviews aren't frightening. It's us looking to make sure that you're the right person for this course. And if for some reason you weren't, we'd advise you accordingly. So and again, if you're doing the apprenticeship route, you'd have that sort of discussion with your employers at that time, and so you would have gone through that process.
Absolutely. Okay, great. That clears that up. And there's just another question here around clarifying if you can go straight from school or college to applying for the course.
Absolutely. I mean, in some ways, a lot of people find it a little bit easier to go straight from studying at school or college and then stepping up the next level in study. Compared to those that may have been out of study for a while. So we do take school leavers, college leavers onto this programme, and what we're looking for is that they've got some, you know, I sit here as a lady of many years, but they've got some experience and why they want to come into this profession. So again, the interview would tease out if somebody coming straight from college is ready for this, because it's not just the academic side, it's actually what it means to be working in that environment and giving care. So there's nothing to stop it, but as I say, we would have that discussion at interview time.
Great, yeah, that's really helpful, thanks.
Okay, I'll talk a little bit more about the application. So the best tip I can give you is to prepare and prepare. As if you were going for a job, really, because you should consider this as being important, and that you've made this decision to come on a course, and you know that it's what you want it to be. So I would suggest, whether it's our university or others in your region, that you look at the university website to be clear on what the programme looks like, because again, some programs will look slightly different and offer slightly different opportunities. So you need to not only choose your university course, but you also need to choose what you hope to get out of that. And you can get information. So if the university offers open days, which we certainly do, attend those, attend any sort of open or virtual event to get some more information. And again, if your employer is offering the apprenticeship and you're currently a healthcare support worker, then you should go to some of those employer information sessions and find out what you can to prepare. Now, part of the application process is to submit a personal statement. And this is about showing your best self. So it's not just about your achievements, but it's actually about you and why you want to come on this course. So, think about your strengths and try to relate them to the course. So, for example, if you've worked in an industry that's not directly care, you could show some of those transferable skills that you've worked in teams before, or that you've worked with customers, in other words, the public, and you can relate your strengths to how you manage customer service or problem solving. So think about what your strengths are and relate them to the course would be my best tip there. And think again why this course excites you. Okay, so why would you choose the course at Buckinghamshire University and what it looks like above the course that you might choose at another university? So know a little bit about that course and think about your experience to date and why you're ready for this course, but also your future aspirations. That really shows that you're thinking about your longer term career. Now, I'm dyslexic, so I do this all the time. I make sure that I get people to proofread my work. Hopefully my emails are okay, but any significant documents that I put through, I get somebody to proofread it. So again, don't be proud, get somebody to look at your presentation, that your application, make sure that the spelling and grammar is correct. And there's a link here, and I think these slides are going to be shared. There's actually a student in the university talking about the best way to write a personal statement. Is there anything you want to pick up here, Kat?
I think that's really helpful. There's been a few questions about writing applications and some tips for doing that. And we've got a couple of people on the call that I know haven't worked in care before, so that's really helpful to kind of understand how they can use their previous experiences to link it to applying for this course.
Absolutely.
Yeah, because it's all valuable. You just learn skills in a different setting. Yeah. And there's just one question around, would it be helpful for people to perhaps think about volunteering before they applied for this course?
Yes, again, absolutely. And volunteering, and that, sometimes it's a little bit difficult to get into the health and social care sector as a volunteer because it takes some time. But excuse me, even if you've done volunteering perhaps in a charity shop and you've worked with different people, that will be some experience. So certainly if you can get some volunteering work or some temporary work behind your belt, then show that transferable skills.
Fab. Great, thanks, Karen.
Okay, so we've talked a bit about the course, we've talked a bit about what the entry requirements are and applications. So it makes sense now just to think about, you've been successful and you're on the course. Now, everybody, well, let's put it like this, nobody's the same and everybody has different challenges at different times. So we are really keen at Buckinghamshire University how we support our students. And by students, I mean students on the course from UCAS or apprentices. So I use that term globally. So we've got some specialised learning development unit that will help in certain those academic learning skills. We've got a inclusive diversity and disability team that supports students, and a student wellbeing and engagement. And I can tell you now, over the past year of COVID, this has certainly been something that our students have engaged in that support there for wellbeing. Now the school itself, the School of Nursing, Midwifery and Healthcare, Nursing, Midwifery and Allied Health that deliver this programme, they've got some dedicated functional skills tutor in their school, in addition to the learning development unit, that support certainly aspects around the functional skills of numeracy and literacy. So they help apply that to the nursing programmes. You'll have a personal tutor or an apprenticeship partnership manager, and these are nominated people that ideally see you through the whole 2 years of this programme, and they're there to sort of certainly give you some pastoral care, but also signpost you to perhaps some of those specialist support units. And we have teaching and practice education teams. In other words, you've got your module teachers and your programme leaders that work really closely with the partners out in placements and practice. They work together to support you. And we've got technology behind this, so we've got an app called Bucks Anywhere app, and literally all of the information would be in one place for you. I wonder if you've got any questions there on anything specific, Kat?
Yeah, that app sounds really helpful, just to have everything in one place, definitely. So you've mentioned about the disability and diversity team. What kind of disabilities or student challenges might that team support?
Okay, great question. And actually, I probably haven't got the time to list them all, but some of the things we know our students have. I mean, dyslexia and dyscalculia from a sort of learning perspective come up very regularly. So what the disability team will do, they'll work with the student to do the assessment and come up with a personalised plan. So somebody with dyslexia may well need extra time in exams because of the nature of their dyslexia, or they may need even more than that, and they may need scribes to support them in their academic work. So the disability team is really there to support anything, whether it's a learning disability like dyscalculia, dyslexia. We have students on our courses that are known to have autistic diagnosis, but similarly mental health diagnosis as well. So they're managed on medication, and that's why we use the term inclusivity, because our student body does represent the population really. And again, if there's physical challenges, whether that's physical in the sense of motor and movement, or even sort of sight or hearing, again, we work with the disability team, but we also work with occupational health that's part of the university. So again, they will do assessments to see what reasonable adjustments may be needed, either in campus, but certainly when you're out in placements as well. So we've got a wealth of experience supporting people with disabilities.
Fantastic. So people aren't going to be excluded that might have worried that something might have excluded them before. So that's really, really good to hear.
Absolutely not. And actually, that's why I actually are quite open with the fact that I have dyslexia. So it hasn't stopped me. I've gone from nursing to education, and now, lead over 3 schools. So it's not a barrier. Don't see it as that. We can support you. So thank you for listening, and if you do require any further information about what the university offers, there's the link here, but certainly just do a search with Buckinghamshire New University. Thank you, Kat.
Brilliant. Thanks so much, Karen. We'll make sure that we share all your slides so people can click on the links that you've got on there. Can I just take this opportunity to thank you so much for joining us today and sharing your time with us. It's been really valuable.
It's absolutely my pleasure. And as I say, if there's any questions that come up following this, then we'll work with you to make sure we get the answers out to them.
Yeah, absolutely. We'll do that. Thank you.
Thank you.
Take care. So obviously we've had Karen just there talking about the university course and the perspective of Buckinghamshire University, but obviously across the South East region that might not be the closest university to you. So on the screen here, these are all of the universities that are currently offering the Nursing Associate programme across the South East as a whole. You'll see that 7 of them are based in the South East, and 2 of them perhaps might be a bit less familiar, that are BPP and the Open University. And these organisations work nationally across the country, delivering different models of education, but they certainly work across the South East. So there's lots of choice for the programme itself, and as a part of the supporting materials that we'll be sending out to you afterwards, we've included all of the links so that you don't need to go on Google and look for them. We'll just have them to hand so you can click through and look at each of the programmes individually at each of those universities. So I'd now like to introduce you to colleagues from Oxford Health Foundation Trust. They're going to speak about their perspective as an employer of having nursing associates work within their organisation. And it's actually great because Ellie, who is on the call, is a nursing associate herself, and we'll hear a bit more about her role as a nursing associate in the education team.
Good morning, my name is Jackie Charrett and I'm the Learning and Development Lead for the Nursing Associate Programme at Oxford Health. And I'm here today with two colleagues, Sarah Thomas and Ellie Barb, who are both work-based tutors and work as part of the Nursing Associate Apprenticeship team at Oxford Health. So we've been asked today to come to talk to you a little bit about the Nursing Associate Apprenticeship programme at Oxford Health. So Oxford Health NHS Foundation Trust provides community health services, mental health services and specialised health services across Oxfordshire, Buckinghamshire, Swindon and Wiltshire, Bath and North East Somerset. So we cover a large geographical area, as you can see from the map. We are a large provider for mental health services and provide both community and inpatient services for both adults and children across the region. Within Oxfordshire, we're also the main provider of community health services and deliver these in a range of community and inpatient settings. And this includes services like district nursing, children's community teams, health visiting and school nursing. We also have 7 community hospitals across Oxfordshire and 3 minor injury units. Oxford Health is also the provider of a range of specialised health services that includes forensic mental health, eating disorders and learning disability. So within Oxford Health, we now have a number of registered nursing associates as well as trainee nursing associates employed across the organisation. And we first started to support staff onto the Nursing Associate programme back in 2017, and this is with our pilot cohort. And since then, we've supported another 5 cohorts through their training on the Nursing Associate programme. We have now just over 80 registered nursing associates working in Oxford Health, and because of this large number, the role is very well recognised and established within the organisation. We also have the registered nursing associates working across many clinical areas, both in mental health settings and in community services. So the Nursing Associate Apprenticeship. So as an apprentice, what can you expect working in Oxford Health? So you will be in full-time paid employment with us. You will also be supported to go on to registered nursing associate positions within the organisation on completion of the course and on receipt of your qualification with the NMC. There will also be onward offers to complete additional studies to become registered nurse as well within Oxford Health. And whilst working as an apprentice, you will be allocated a clinical area that you'll be assigned to for 2 years of the programme, and this will be known as your home base. As well as working in your home base area, you will also complete external placements in clinical settings that are different to your home base. So by the end of the 2 years on the programme, you will have had experience in working across the 4 fields of nursing. So this is adult nursing, mental health, learning disability and paediatrics. Okay, so I'm now going to hand over to my colleague Sarah, who's going to tell you a little bit more about our partnership with Bucks New University and the role of the work-based tutor at Oxford Health.
Hello, so I'm Sarah and I'm one of the work-based tutors in Oxford Health. So the Nursing Associate programme in Oxford Health is delivered in partnership with Buckinghamshire New University. During your 2 years, you will be given 1 study day a week, and these will be to attend lectures and seminars. These will be delivered by either the university or by Oxford Health staff. Due to COVID, much of the teaching has had to be delivered online and only with a limited classroom teaching. However, this has not affected the current cohorts and they have managed to progress with their course. At Oxford Health, we have a skills lab, which is where much of the clinical skills, such as taking blood, will be taught. Oxford Health will be your employer whilst on the course, and we also deliver 30% of the curriculum, and the teaching that we provide is usually all clinical practice and skills. So the role of the work-based tutor. There are 6 work-based tutors, and between us we cover most fields of nursing, so we all have our own speciality. We help the learner with their practice assessment document, which is your achievement record, and we also help the learners with their competencies on their placements. We have 2 programme leads on the Nursing Associate Apprenticeship, and the programme leads liaise with the university as well. The work-based tutor also helps with arranging meetings between the learner, Buxton University, and also with the ward supervisor and assessors to monitor the learner's progress. We also assist with and run reflective practice sessions and are available for any pastoral support. It is the pastoral support that's been given that has enabled the programme to be successful so far in supporting a large number of students through the apprenticeship programme. I will now hand over to Ellie, who is going to tell us about her experiences.
Hi there, so I'm Ellie. I was part of the pilot course back in 2017, and I am now a registered nursing associate and a work-based tutor in the learning development department. So first starting the course, I had a mixture of feelings. I was extremely excited that I had been given this chance to develop and progress further in my career. I was looking forward to learning new skills and furthering my knowledge through higher education, all while being supported by my employers and the team around me and getting paid to do so. I felt that I was ready to take on a new challenge and was extremely grateful to have this opportunity. I also felt quite apprehensive. I had not studied to this extent since school, and as I was part of the pilot course, I did not know what to expect. I was worried whether I'd be able to successfully complete assignments and exams. Also meeting new people, heading to university once a week, getting to know my way around, all these aspects caused me some trepidation, but I knew this is something that I really wanted to do, so I would find a way to overcome it. So once I started, everything did slot into place. I made friends, got into a routine, getting to uni early and enjoying a cup of coffee before lectures started, and found my own way of studying to suit the way I learn. This took a little while to work out, but once I did, assignments and exams were not so daunting. Throughout the course, I think everyone will have their ups and downs, but no matter what came up, I found a way through it. There was excellent support from both work and the university, which made the whole experience much easier. Once qualified, I was proud to become a registered nursing associate. I was now able to take on new skills and responsibilities at work. I have my own registration, so now I could work autonomously. My background is within minor injuries department. We had a strict scope of practice. There were certain competencies that I had to build my knowledge and skills within to be signed off as competent. These included being able to assess, treat and discharge patients with injuries that I could independently assess. If the injuries were outside my scope of practice, I would seek guidance from a practitioner I was working alongside. I could treat suitable wounds independently and started suturing. I could assess eye injuries and make referrals to plastics and burns unit. It was great taking on new responsibilities and being able to support my team with having these new skills. So then my career took an unexpected turn. Sue, the work-based tutor who supported me during the course, sent out an email stating that there was a role available in learning and development as a work-based tutor. I thought I'd love to support those throughout their course as I was. So I applied and was fortunate to be successful at interview. So I'm now a Band 6 work-based tutor supporting nursing associate trainees on their course. I had no idea when applying for the nursing associate role that I would move from minor injuries to learning and development, but this just shows how versatile the role is and you can't always predict where it can take you. So we hope you enjoyed our introduction and thank you for listening.
Thanks to Oxford Health. They are a great employer that we have across the South East, really supporting the apprenticeship option for nursing associates. And actually their lead for their apprenticeship team, Becky Ellsworth, has just recently last night won the award for the Oxfordshire Apprenticeship Champion. So that team are hugely supportive, and I think that one of them mentioned about the pastoral support that they offer students, which is just so important. So I'd now like to introduce you to Michelle Horn. Michelle is the Assistant Head of the Nursing and Midwifery National Team here at Health Education England. And we've just heard from the previous speakers about the nursing associate role across a community and inpatient setting. But we obviously have lots of places that across health and social care that nursing associates can work. So Michelle's just going to speak to us a little bit about the nursing associate role in primary care. Michelle.
Thanks, Kat, and thanks for inviting me today. So I am a nurse and I've also been a midwife. However, most of my career has been in general practice. It's a really exciting place to work, and the thing that I like about it is being able to build up relationships with patients and their families. So general practice, it offers a large scope of opportunity, such as learning and looking after patients with long-term conditions, and also promoting health and also screening. So we've got a lot of healthcare assistants that are in general practice, and many of them have got a lot of experience. So now they have an opportunity, if they wish, to progress onto the training nursing associate course and become a nursing associate. And as James mentioned earlier, they can then decide if they wanted to become a registered nurse. So there's a complete career pathway from healthcare assistant to a registered nurse. So what is primary care? So primary care services provide the first point of contact in the healthcare system, acting really like the front door of the NHS. So it includes GPs, practice nurses, healthcare assistants, pharmacists, paramedics, community nurses, physios, opticians, dentists. So a vast number of health professionals making a multidisciplinary team. In secondary care, which is known as, your local hospital, if you like, that's more specialised. So it's really, really important that primary care, we look after patients and we establish relationships. But sometimes, we can't always look after the patient because they need more of a focus on specialist care, and so therefore we need to refer them to the hospital setting or to secondary care, or they may need a transplant or something really specialised. So that's where the tertiary care comes in, and we can refer them to specialist centres. So the pyramid represents how many patient interactions there are in different settings. And as you can see, there's quite a few in primary care. So primary care is not only about looking after patients who might be poorly, but also helping patients to manage their own health and to keep them as well as possible. So when I was thinking about this earlier, I was thinking about patients that I used to see in general practice. And a patient might come to the general practice and have an appointment to see me for their childhood vaccination. But then later that day, they might need to come for their own asthma check. And because they've got asthma, they might need a flu jab or a COVID vaccination. And they also then may need a medication review going forward. But they also might visit me for a family planning problem that they have, or some advice. So you can see how many interactions that you have with one patient and also their own families. And this is it's so nice to be able to build up that relationship with them. So here is some examples of what a nursing associate could do in primary care. So there's some options here. As I've said before, they could assist with monitoring patients with long-term conditions such as asthma, diabetes, chronic obstructive pulmonary disease. They could do some health checks and learning disability checks to make sure that the patients are healthy and well. They could give vaccinations such as vitamin B12 injections, flu injections, and particularly the COVID vaccinations now. They could lead the practice in infection control or learn how to do some dressings and wound care and suture removing. Or they could undertake cervical cytology. This obviously needs additional training, but once you are a nursing associate, there is a pathway for you to undertake some more extended roles. So next steps. So if you are a healthcare support worker today, and you're thinking about wanting to do the training nursing associate role, please have a word with your line manager and you know, or if you're at an appraisal situation and you can talk to your line manager, that would be really good, and discuss your career options. Also, you could contact the primary care training hub leads that we have in the regions with your line manager, and they could talk through the options with you. So if you, I think there will be some links to the training hub leads. I think that's it. Thank you so much for listening, and thank you for the invite. It's really nice to talk about general practice and primary care.
Thanks, Michelle. I can definitely hear and see your passion for primary care coming across, and I know that we had well over 100 people registered that are based within primary care across the South East, so I'm sure that that will all be really helpful to them to hear about. So thanks very much.
Okay, thank you.
So we're now just going to take a short break, because obviously attending a webinar can be quite full on and we all need a time to stretch and have a drink. So we're going to take a break now until 20 to 12. We'll be restarting the webinar again on this link at 11:40, 20 to 12. Thank you. So thanks everyone. I hope you had a nice break and you got a chance to go to the toilet and get a drink, stretch your legs and just refresh yourself a bit. And I'm really pleased now to move on to the next section and to speak to Peggy. And Peggy is a nursing associate who's based down in the University Hospital Sussex on the south coast. And we're just going to have a little chat about her experience as a nursing associate. So welcome, Peggy.
Hello, Kat, thank you.
Hi, thanks. Lovely to have you with us. So I was just wondering if, first of all, you could tell us a little bit about your journey to becoming a nursing associate.
Yeah, absolutely. First of all, I just wanted to say it's really great to hear of so many people attending today that are really interested in the role, and thank you for inviting me to speak a little about it. I hope it will give you a little insight of what the role is about and of my experience personally. So I used to work in community care, and then I worked in a care home with nursing. Then I started a job within the NHS 5 years ago now. I spent 2 years in day surgery, in the day surgery department. And I was looking for some sort of training to undertake, and this role came up as a new role to our trust, and it was recommended that it was the right role for me to undertake. So I started on the Nursing Associate Foundation degree. It was very new to our trust because it was I was part of a first group, the first cohort that our trust and the university had taken on board. And there were 5 of us in that group. So a lot of it was all about sort of speaking to people about the role and finding out about the role ourselves, because it was ever so new to us.
Yeah, I can imagine that was quite tricky, but it sounds like you've done a good job.
I hope so.
So what would you say that you enjoyed most about your course then?
As well as meeting all my uni mates and making some really good friends there, which was amazing. There's quite a few things actually. I didn't go to university as a youngster. So in my cohort, there were age ranges from early 20s to somebody who was 58 when they started the foundation degree. I was 45 when I started, so you know, age isn't a barrier on that at all. So as well as meeting new people, the whole university experience at my age, I really enjoyed a couple of the modules the most, which was evidence-based practice and legal and ethical foundations of health and social care. It's a bit of a mouthful, but it was really lovely to learn something completely new and something I hadn't studied before, and at a whole different level.
Yeah, I think, you know, you're absolutely right there. There is so much to learn, like the theory side of things. There's the kind of going to university side, which is so exciting. And yeah, really a good point that you mentioned that age isn't really a limit on these things.
Not at all, no.
Yeah, the opportunities are there for everyone. So obviously the nursing associate role is a role that works across the 4 fields of nursing. So that's adult, child, mental health and learning disability. I just wonder if you could tell us about how that was covered during your training.
Yeah, so we went on placements. We had 2 placements per year. In the first year, I'm just trying to think back because it was 3 years ago now, and so much has happened and so many learning experiences. I had a placement on emergency floor, and that was my first ever ward-based placement and my first placement within a nursing associate foundation degree. And I just met all sorts of different types of people with all different health conditions. And because it was my first ward experience, I shadowed the HCAs and the nurses. And I was also finding out about my role and telling them about my role as well. So with all different kinds of people that we had coming through the emergency department, there were people with learning difficulties. And a way that I found out about how to promote their health and how to care for them best, I looked at care plans and I read about communication. So that was really interesting. I had a mental health placement where I spent 150 hours over about 5 weeks with 2 lead practitioners, and I learned and met lots of people with mental health conditions. And I researched it. So I went on the Mind website and I ended up making a booklet about different sorts of mental health conditions that I then showed one of the nurses that I was shadowing. So I really managed to find out a lot about mental health. I also went to a sort of outpatients department, and I shadowed lots of different healthcare professionals like lung specialists, cardiac surgeon, bowel surgeon, specialist nurses. I spent time with an anaesthetist, and he was discussing in theatre what he was doing with the patients. I spent lots of time within different multidisciplinary teams and learned about people's different roles, such as the dietitian, an injection clinic, urodynamics. Too many to mention, but it helps you have a whole sort of rounded experience for the role. So you might be working away from your area, but you still have the experience of how other teams work, and that's a really valuable experience. It just like rounds off what we're doing.
Yeah, definitely. And what role do you work in currently? Where are you based now that you're a qualified nursing associate?
So I work in ophthalmic surgery and day surgery. I qualified a year ago, and I've been learning how to scrub for cataract surgery and oculoplastic surgery. So it's been really interesting and a real big learning experience because I never got to do the scrub side as an HCA. So I'm just learning every day really, and I absolutely love my role.
Yeah, you can definitely tell it comes across.
Oh, thank you.
So whilst you was training, you trained as an apprentice, didn't you? And obviously the clinical education team in the hospital would have been able to support you in that role, and your manager and on your department. I just wonder if you could explain how the educators support you in practice.
Someone from the practice education department actually came into uni and they supported us really well like that. I think because we were the first group that the trust had, they were really involved in meetings at the uni and everything. So that was fantastic. My manager herself, you know, she managed to look after my sort of holiday requests and things like that, and my placement times, and I could always go to her if I needed any extra support. She just really supported me with everything.
So lots of support available from the education team, from your manager, from the university, both from your peers as well, the other people on the programme.
Yes, definitely. A lot of learning came from each other because I was the only person from the surgical department on the course, but there were people from community, so it's all their community experiences they were talking about. Lots of people from mental health hospitals. So, you know, we learnt a lot from each other because we all came from different departments.
Yeah, that's really valuable and really nice to have each other to support. So, yeah. And what do you think so far has been the most rewarding part about being a nursing associate?
I think it's a big part of it, I think, is just doing something a bit more, you know, enhancing my learning and academia and skills and meeting different people and learning how to best look after our patients, not only in a medical way, but the holistic way as well. It's very valuable. I think it sort of made me grow more as a person, just having all these different experiences. And also I find that I can cope with things better as well. I think because of having some training and I look at things a bit differently as well. It's just, you know, enhance my personal being.
Absolutely. That's really good to hear. I think, you know, working within health and social care can be such a rewarding job. So yeah, it's good that you've described it that way. And obviously we have lots of people on the call today that are interested in becoming a nursing associate from many different walks of life. So do you have any advice for them if they're thinking about applying to university or with their employer to do the role?
I would definitely use social media such as Twitter and join @We Nursing Associates or Student Nurse Network pages, because there's a plethora of people out there that can help to support you. It's so fantastic for advice. I was on there today because I'm doing some evidence-based practice work, and I just threw out a question and a nurse came back to me and said, oh, she's done that and she can help, and to send a message. So there's lots of support out there. I would also get somebody else to read the application for you as well. So just to check over that everything flows and it makes sense, as well as like reading the job description really, really thoroughly, looking up whatever you can about the nursing associate role, how it was developed, why it was developed, how long it's been going, just everything you can, NMC, anything you can about the nursing associate role would be really helpful.
Yeah, social media can be really helpful, can't it? Just to help with that network that we mentioned earlier and having others to talk to about the role and kind of, you know, share your experiences, and perhaps people could even, you know, use this webinar and reference this webinar if they were to go for an interview to say how they've looked into the role and found out some more details about it.
You can't underestimate interprofessional connections.
Yeah, definitely. And so lastly, have you thought about where your career might take you? So you've been qualified a year now, and are there any next steps for you?
At the moment, my job is so involved that I really want to concentrate on learning what I can about ophthalmic surgery and the different sorts of surgery that we do, because there are so many. There's not just cataract surgery, there's like a multitude of eye surgeries, and how, you know, I can go about that and help best look after our patients. Yeah, so at the moment it's a lot of settling into the role, because it, obviously, as I was saying, it was very new to our trust. So just trying to do the best job I can and be the best nursing associate that I can possibly be.
I don't think you could ask for much more than that, can you? So thanks so much, Peggy, for joining us today. I really hope that your experiences help everyone on the call kind of understand the role a bit more and hear it from your point of view.
Thank you so much. I'm also happy if you want to give out my NHS email at some point. If anyone would like to ask any further questions, then I'd be happy to try and answer some.
Oh, that's great. Well, thank you so much, Peggy.
Thank you. Good luck.
It was great to hear from Peggy as an expert by experience, being a nursing associate herself. I think there's some real value from that. And this next video is from Monica, who is a HEE Nursing Associate Ambassador as well. And I think that she gives some great advice around the role, how to apply also, and a bit of, you know, how her life experience brought her to becoming a nursing associate.
My name's Monica. I am a training nursing associate, soon to become a registered nursing associate. I work alongside the doctors and the nurses and provide extra care for them, and that basically involves doing all medications, looking after their general well-being, helping them with washes, helping with their feeding if they need to, and their hydration, so making sure that they're drinking plenty when they're in hospital, and also helping them towards getting better and actually leaving hospital. And that happens to be my favourite part of my job, is seeing people getting better and actually going home back to their families. But the most important skills, which is something that you can learn from now, is having good listening skills and communication skills. I think that's really important, and it's good to be able to judge how a person's feeling. That's really important. That's a key skill, I would say, that you need for this job. I actually started working in retail, so I worked for a store called Homebase as my first job, and where I was working on the checkouts, and I absolutely loved it. I ended up working for a bank, and I actually became a cashier in a bank because I think it was probably that excitement of working with money. So whilst I was working for the bank, I actually found out that my husband was really unwell, and he was going to have to go through some life-changing surgery, and he was actually going to be treated for cancer, which was quite a difficult time for us as a family. But it was also a really special time because it meant that I got to spend lots of time with him in hospital. My husband had said to me, you know, you seem to be so happy when you're in the hospital. You know, there's just something about it. You know, what is it that you've always wanted to do? And I said, actually, I've always wanted to be a nurse. And so we talked about it, and my husband agreed. He said, actually, do you know what? You should think about it. You should do it. So it was a real big decision to make at the time, but I think because it was steered by something that was quite a difficult time in our lives, we thought, actually, why not do it? You know, let's live today to the fullest and actually do what we want to do. So I actually took voluntary redundancy from my job. So I actually joined the local college and did an access course to further education. I think the best bit of advice that I would give is to think about what subjects you're actually doing whilst you're studying already. So if you know you want to go into a career in nursing or in the NHS or any career that you want to go into, your maths and English are really, really important. So think about you know, what level you're at and where you need to get to, and if you can actually get your maths and English GCSE, then you're set up for life. If I could speak to my younger self, I would probably say have the confidence to go for what you're really passionate about. I think there was a lot of pressure when I was younger to sort of go on and do things which were deemed as, you know, doing something specific. So, you know, like if you want to be a doctor or a lawyer or something like that, but actually I always knew that nursing was what I wanted to do. So I wish I'd sort of just stuck to that idea and then gone for it. Think about where you can get opportunities to sort of get ahead of the game, and if you can go and do work experience in different areas, then do. If you can speak to a careers advisor, then speak to them and see see what things that you need in order to be able to be ready for when it comes around to applying for courses at university.
So I think Monica had a great piece of advice there on her video, and it really shone through, I suppose, about doing something that you're passionate about, living today the fullest. And if you think that you're interested in a career within healthcare, I suppose trying to make those next steps. Lots of people do end up working in healthcare after personal experience, friends experience, just having a bit more of an insight into what happens within health and social care. Because perhaps before then you don't really know the breadth of what your career might look like in this space. And what I've just tried to do here on this slide is summarise some of the many places that you can work across health and social care. We've obviously heard from speakers today based in an acute hospital, in a community hospital, but that's not to say that all of these other places aren't just as valuable places to think about how your career in the health and social care world could take off. I think it's really exciting that roles such as the nursing associate have such a broad range of places that we can work. So as you're training, hopefully you would go across many of these environments to gain experience. But when you're qualified, the world is your oyster, really. I think, yeah, hopefully this slide summarises that up for you. We've had lots of questions through about how you might be taking your own personal next steps. And whilst we can't give career advice for the hundreds of people that we've got here today, what we're hoping to do is just summarise over the next couple of slides what you might think about as your next steps. So over here on the left hand side, we've got school and college students, healthcare support workers, people working within and outside of health and social care at the moment. And you would have heard us speak a lot about the UCAS route or the apprenticeship route. So there being two routes to becoming a nursing associate. Both of those routes, it's a foundation degree that you're obtaining, and you'll hear us repeat again and again about maths and English. And I'm sorry that we repeat that a lot, but that is a really key part of entry requirements that you need to have by the time you register with the NMC. There's something called the Care Certificate as well, which is a piece of training that you do upon joining health and social care that isn't mandatory but is helpful. So if that's something that you have access to doing, I'd really recommend to look at that. I think that hopefully you'll see the value of the nursing associate role in its own self. This quote here on the screen really describes that as a nursing associate they've been able to do more activities, and I think that we really do value the nursing associate as a career in its own right, as a destination career and not just a route of which you might become a registered nurse. Whilst that might be your ambition, and in the future you might wish to do that, actually that's not necessarily for everybody. So once you've become a nursing associate, there is options to go on and do further study to become a registered nurse. We've had a few questions about this come through the chat today as to if this might be possible and how is it possible. So essentially, when you become a nursing associate, you have that qualification that's at a foundation degree level. You can then use that qualification to apply to university for registered nurse programs. But remember, your nursing associate qualification is a cross-field qualification, so it's not specialising in one of the fields of nursing, but becoming a registered nurse, you do get that specialism. So you'd be looking at deciding if you wanted to join one of the 4 fields of nursing, and you'd apply for that programme. Because you've got your foundation degree from becoming a nursing associate, that will shorten the course that you're going to study if you choose to become a registered nurse. And the length of time that it shortens it by is dependent on where you studied your nursing associate programme and also what programme you're going on to study. It's a process that is done with the university upon application. And if you need more advice about that, then we can offer that to you at another stage. So now we're going to move on to our question and answer session. I can see that we have had so many questions come through on the chat. I don't think we'll be able to get through quite all of them, but we will make a good go at this. So I'd just like to introduce Claire Wardle, who's going to be helping us with this section of the webinar.
Okay, thanks, Kat. Yeah, some brilliant questions that have come through. So if I can make a start, perhaps this is a question I can direct to Michelle about placements. And question is, do I arrange my own placements and where am I likely to be? In what areas?
If Michelle isn't able to take that question, yeah, I'll take that one, Claire. That's fine. So around arranging placements. Yeah.
Yes, and where are these areas likely to be?
Okay, so arranging placements won't be down to yourself as a student or a learner. That will be done through the university or your employer. They'll be leading on that and working. They'll be working quite closely together, the employer and the university. And your placement should be giving you the breadth of experience that you need to qualify as a nursing associate. So by that, I mean having experience working across all of the 4 fields of nursing in a wide range of healthcare settings. So you might be based, you might be working in theatres such as Peggy, but during your training, you'll go and have placements out in all of those different areas that we just mentioned on the screen previously. So you might be going off to a GP surgery, you might go to an outpatients clinic, you might go to a nursing home, over to a children and young people department. So it's really exciting, I think, doing placements. Students really enjoy that part of the course.
Okay, thank you. Another quite practical question about hours. A number of our attendees work part-time hours. Can we just give a little bit of guidance about working part-time? Is this possible on this course?
So the course is quite full on, I suppose. It is a foundation degree, and for most of the courses you need to work at least 30 hours a week to be on the programme. And it might mean that if you're working part-time that actually your programme length is slightly longer than 2 years, as most of the programmes are, just because we have entry requirements from the Nursing and Midwifery Council around how long we have to spend on placements, how long we have to spend studying to get our registration. So it is possible from 30 hours upwards. If it's the apprenticeship route, that would also be down to the employer as well. They may only be looking at apprentices that can work at the full-time level.
Lovely, and we have a number of queries from perhaps more mature students and older applicants. Is this opportunity still open to them?
Oh, absolutely, yeah, completely. So you might have heard the term apprenticeship being used, perhaps historically, being referred to courses that young people undertake kind of upon leaving school, and it being very practical roles that they do through an apprenticeship. But apprenticeships now are open to everybody. There isn't an age limit around them, and I think that's a great opportunity that we have to grow and develop and to study. And actually you can have apprenticeships all the way up to master's level, which people might not have realised before. So there are different levels that you can study the apprenticeship at. So there are no barriers from age, and I think Peggy was a good example as well. She mentioned that there were colleagues on her apprenticeship that were of a wide range of ages. And I think that's the thing, reflecting back on my own training to become a nurse. We had people from all walks of life, of all ages, joining, because you've just got that great career that you can have within health and social care.
Thank you, Kat. And you mentioned at the start how you've supported a cohort of nursing associates through. What would you say how someone can really stand out as a promising candidate?
That's a great question, and I think that there's lots that you could think about if you are thinking of applying right now. So firstly, I'd be going to take a look at the university websites that we'll be sending around for all the universities. that offer the Nursing Associate programme across the South East, and look on their pages about the Nursing Associate programme. So what modules do they study? How do they study? So is it done remotely like this, online? Do you attend in person? Is that changing after the COVID situation, obviously? Are they going to go back to classroom learning? Then have a look at the entry requirements. So whilst we've touched on what the entry requirements might look like from Buckinghamshire New University, they might be slightly different at other universities. So just be really clear and look at that. And if you're thinking about doing this role, then think, well, if that's what I need to get to when the programme starts in 6 months' time, how do I get there? So what do I need to go away and do? And if it is your maths and English, as you've mentioned, Health Education England do offer some supporting materials that we'll put out in the links that we send out after this event, so that you can look at doing those courses and studying for your maths and English. So that would be my first piece of advice, is looking really closely at those websites. Also take note of the closing dates for applications. So, you know, if you're looking to start studying in September, I think I'd be really advising to get on those websites this evening and be taking a look at things, because the cut-off date for applications might be relatively soon. So that would be the first thing. Thinking about writing your personal statement, what you really want to do is make your personality shine through. You're really trying to describe what it is you've got, your attributes, why you want to do the role, and make that come across, because this is your chance to shine. This is your opportunity to start your career. And again, at interview shouldn't be a scary thing. It might be a bit scary, but that shouldn't be the be all and end all, because actually what we want to do, having been an interviewer many times for the Nursing Associate programmes, is we really want to see you. We want to know why you want to do this programme, what interests you, what motivates you, and what can you apply from your previous experiences through work or study or personal life experiences as to how you might bring that to the course. We don't expect you to know everything. You know, you're not coming onto the programme and just starting by knowing everything about the Nursing Associate role, but we'd like you to have done a bit of research. So yeah, I think hopefully that's a good set of advice. I know that if you look on YouTube, we've got the links to a YouTube channel all around Nursing Associates as well. There's lots of advice on there as well.
That's great, thank you. Hopefully we've got time for one quick question about sort of timings. When would you suggest that people do look at some of these job sites, and who should they talk to, perhaps in their organisation if they work as a healthcare assistant? Great question. Yeah, so I suppose a lot of my previous answer could be used for both the apprenticeship and the UCAS route, but if you're interested particularly in the apprenticeship route, so that's studying and working at the same time, I would recommend to look at the NHS Jobs website, and there is another website as well that we'll be showing you on the next screen as to opportunities that arise for Nursing Associate apprenticeships across the South East. So you can set up reminders on these websites to email you daily with particular search terms as well. So you might put in a search term, Nursing Associate or apprenticeship, and what that will do, or you can put a radius as well around where you live. So you might be looking for an apprenticeship across 30 miles from where you live. So you can put that search term in, and then that will email you daily or weekly with any updates. So that's a great way of kind of keeping on top of all of the jobs that might be coming out. I know that there are lots of programmes that tend to start around September or October time, but actually most months of the year we have a programme starting across the whole of the South East region. So it's not that if you miss out on September you'll have to wait a whole new year. You know, and I know that we pretty much have programmes starting August all the way through to December and then starting again next year. So there are lots of opportunities out there for that. Does that answer that question, Claire? I think that's great. Thank you very much, Kat. Yeah, great. All right, thanks so much, Claire. And I recognise that we had many questions that came through. I don't think we had a chance to answer them all there. But
but we will be picking those up and getting the answers out to you. Speaking to our speakers as well, if you've sent in a question for them that we haven't answered, we'll make sure that we get that content and we send that out to you, and we hopefully will be putting that on the Health Education website, Health Education England website, as well as a resource to look at. So the next steps, like I said, are going to be slightly different for everybody. Over on the left hand side, there's some next steps that everybody can be thinking about. And hopefully I've mentioned and touched upon lots of these. One thing that I'll just bring up there that I haven't touched upon is the NHS Careers website and the Health Careers website. So these are great resources, and you can look at the different roles that you could be interested in. Nursing associates obviously being hopefully the one you look at in particular. All sorts of very good, reliable information on there. And I think if you're at school or college, your next steps might be slightly different to if you're working within health and social care, or even outside of health and social care. So when you get this slide, just take a bit of time to work through each of those steps and have a think about who you need to speak to, what you need to go off and do. And if you're struggling to find your contacts and the right people to speak to about this slide, you can just let us know in the nursing team here at HEE South East, and we can help guide and support you through that as well. We're also really aware that perhaps there might be other things that you were expecting to have heard about today that we haven't had a chance to talk to you about. So we'd really like to know your feedback as to what might be helpful for you to attend or be part of in the future. So would it be helpful to have any more future events about the nursing associate role? And if so, what kind of topics would you like to see covered during that? Would it be helpful to have different events via social media, so trying to do an engagement on those sorts of platforms? If you're familiar with Twitter, would Twitter chats help? Or would it be helpful for us to develop some more case studies and share those links to case studies, because you work in a particular area such as school nursing and we haven't really touched upon that today? So would you like to read something about a nursing associate in that type of environment? Or actually, would you like something about the particular sector that you work in? So are you based in social care, in nursing home perhaps at the moment, and you just really want to talk to a few other people about the nursing associate role in that area? Would that be helpful? There might be other things that will be helpful as well. So we're really keen just to hear from you. And as we said at the beginning, our whole job at Health Education England is about supporting the future workforce. So we're here to support you to meet your ambitions, really. So anything we can do to support that, we will do. So there's been a lot of content this morning about the nursing associate role. And this slide, we've just tried to summarise everything today. So the nursing associate role is the new role in England, bridging that gap between healthcare assistants and registered nurses, based off of a report after we saw some very poor care a few years ago. Nursing associates work with a variety of people across all ages and across all health and social care settings, and they very much deliver hands-on care and are a vital part of a patient and person-centred healthcare team. Across the South East, we have trained so far 779 nursing associates, and we have 842 in training. So there's a lot of trainees out there. But it is still a small role in comparison to other healthcare roles. As we've mentioned, the different routes to training. We've also mentioned the Nursing and Midwifery Council and the role in which they play in being our regulators as of the nursing associate role. We really hope the webinar has helped you gain an understanding, a bit more of an understanding about how to apply for the role and what you think your next steps might be for your career as a nursing associate. So please don't be shy, we're very keen to speak to you and we're very keen to support. So you'll see on here, that's our team's email address and my email address, so I'm very happy to help. Our team covers wider projects across the nursing and midwifery and maternity world as well. So it might be that you haven't got a question specifically about nursing associates, but something about the wider nursing or maternity workforce. And we're really happy to hear from you. So please do just drop us an email. We've got some links on there as well about websites that I've mentioned previously. So the Health Careers website, our HEE Nursing Associate website, Skills for Care, which is an excellent website, has lots of resources on looking in particular around the social care sector, so nursing homes, domiciliary care, and then the UCAS website, which is really important, and that what you need to look at if you're thinking about the direct entry student nursing associate route. We've mentioned social media on the call as well today, and how helpful that can be as a network and as a communication tool. And I'd just firstly like to say that social media is a really great tool to use, but we do just need to err on the side of caution with our professional responsibility using social media. And the Nursing and Midwifery Council have got some guidelines that we'll again attach to the documents afterwards around using social media in a professional manner. But don't let that put you off. You know, there are some accounts on here that we would recommend to follow on Twitter. The We Nursing Associates account, the one at the top, is a really active account that shares the experiences, shares questions of trainee nursing associates and qualified nursing associates, and is a real great peer support network. They use the hashtag there, We Nursing Associates, a lot, so you could follow that on Twitter. And again, you've got our HEE Southeast account and my own account. You'll find me merrily tweeting about nursing associates all of the time. So on the feedback form that will shortly be appearing in the chat box for you, we'd really encourage you to give us some feedback on the event today. Has it been helpful? Would you like to attend this sort of event again? And if so, what would you like it to look like? Just as I mentioned on the previous slide, your feedback is really important to us because we need to make sure that we're doing the right thing for the people that we're working with. I'd like to take this opportunity to say a few thank yous. So thank you very much to all of our presenters today for taking their time out of busy clinical schedules and academic schedules to join us. I think that hearing from their experience has been really powerful. I'd like to thank you all as attendees for joining today, even if you're live or if you are recorded. You're not recorded, but you're watching a recording, and that you find this webinar useful. And then I'd thirdly like to thank all of our HEE staff behind the scenes who you haven't been able to see, who have been working tirelessly to put on this event for us today. So thank you to everybody. I'd like to leave you on a video that has been produced a couple of years ago now, but it really looks at the whole spectrum that you could work across health and social care, the impact that you can have on people's lives from birth all the way through to death across a wide range of settings. And I think it's just the perfect way to end what is hopefully the first steps for some of your journey towards becoming a nursing associate. So thanks very much everyone, and enjoy this video. Have a lovely day afterwards.
What is hiding in those weak and drunken hearts? Guess he kissed the girls and made them cry, those hard-faced queens of misadventure. God knows what is hiding in those weak and sunken lines, fiery throngs of muted angels giving love but getting nothing back. Oh, people, help the people, and if you're homesick, give me your hand and I'll hold it. People, help I'd be cold as a stone and rich as a fool that turned all those good hearts away. God knows what is hiding in this world of little consequence. Behind the tears, inside the lights, 1,000 slowly dying sunsets. God knows what is hiding in those weak and drunken hearts. It's a loneliness game knocking. No one needs to be alone or singing. People, help the people. And if you're homesick, give me your hand and I'll hold it. People, help the people. Nothing will drag you down. Oh, and if I had to break, oh, and if I had to break, I'd be cold as a stone and rich as the fool that turned all those good hearts away. I'd be cold as a stone and rich